Hi everyone, I'm Forbes Riley. Let me ask you a question. When you wake up in the morning, do you hurt? I mean, if you're like me, maybe you've been in a car accident, a ski accident, or in my case, I tore my ankle just stepping off a curb. Odds are that at a certain age, life has taken its toll on your body. You suffer from pain in your knees, your shoulders, your neck, and the worst part, when you're in pain, it's hard to get a good night's sleep. Well, what if I told you there was a solution? One that requires no surgery and no downtime. With this type of cutting-edge regenerative medicine, imagine that you can once again live life to the fullest and enjoy all those things you thought were not possible, like playing with your children, your grandchildren, taking a walk on the beach, playing around a golf, or even just enjoying a good night's sleep. In a moment, you'll discover how this revolutionary breakthrough in medicine is now available to all of us, helping to diminish pain in your ankle, your knee, your hips, shoulders, and even back pain. But it also helps with neuropathy and pain associated with arthritis. In a moment, you'll discover that you can once again enjoy the activities in your daily life. And in just a moment, you'll discover the secret to turning back the hands of time. See, the good news? You no longer have to live with pain, thanks to the Stem Cell Institute of America. And on our show, you're going to hear from top researchers, doctors, and patients who call this therapy nothing short of a miracle. So let's get started by meeting my first guest. My name is Dr. Jill Howe, and so excited to have you on the show.
Thank you.
Tell me about your mission.
Well, I'm on a mission to help people across the country understand the incredible capabilities that stem cells have.
So what is a stem cell?
Well, a stem cell is a cell that everything in your body stemmed from. It's what made you. It's what made your eyes, what made your hair, what made your knees, what made your fingers. It's everything in your body came from a stem cell.
Do you know how many people this will help?
I do, and that's why I'm on a mission, is to get the word out there, because I think that's why so many people aren't aware of what it is, including maybe some doctors, because there's not enough information.
So I just have to ask you, if you've got pain anywhere, if you're suffering in your joints, your ankles, your knees, your hips, your neck, your lower back, and now if you've got arthritis or neuropathy, there's so many treatment options just go get educated to find out what your options are.
Right, you have nothing to lose. Here's one guarantee I can make, because you can't make guarantees in medicine, but one guarantee I can make is if you don't do anything about your health problem, it will get worse.
So is this therapy right for everybody?
It's not right for everybody. I would love it to be the answer for everything, but it's not right for everybody. But I'll tell you what, the people that it's right for, oh my gosh, like Jerry, who had 30 years of back pain, couldn't even dry off after he got out of the shower, had tried everything from doctors to shots to surgery. Now he's feeling great. He's walking around, he's gonna start playing golf again, and he got his life back.
Just from a treatment?
Just from one treatment. It's incredible.
Well, we continue to hear story after story of what patients are calling a miracle therapy, truly being able to live without pain. Take a listen to this one.
I thought I was gonna have the pain for the rest of my life, till I got those stem cell injections 2 months ago. Stem cells really did the job.
Well, now we're going to hear from somebody very special. He's a top 20 finisher in the Chicago Marathon who thought thanks to pain he would never be able to run again. Let's take a listen.
Pain does funny things to you, and getting away from pain just opens the door to let your life go again. It's got me jacked up. I'm ready to start training again to the level I was. Being an old man, you learn things. I'm going to be a wiser runner now, and I'm going to have the hip that I had when I was young.
When I started having the pain level went up to 8. And after the treatment, my pain level is less than 1.
So I met Jerry, your patient, and I'm going to tell you, let's take a listen to his testimonial. He's right there.
We went ahead with the stem cell treatment on my back. And right now, I would say the pain is not there. When it first started, it was, I would say, a good 9, 10. And now I just don't have that pain at all. It's gone.
It makes you feel very sad to watch someone hurt the way he was. He couldn't sleep nights. He was just in pain all the time. He's much happier, which makes me happier.
After treatments at the Stem Cell Institute of America, my pain level went from a 10 down to perhaps a 2 or even a 1. The major thing, however, is at the start, when I got to where I could only walk, let's say 3 blocks and get to a pain level of 10, now I can walk probably 3 miles before I get to any significant pain level.
Well, now I'd like to introduce you to a podiatrist who uses amniotic tissue in the healing process in his practice. Please welcome Dr. Lou Chiliberti.
Hello.
Lou, how are you?
Good, nice to meet you.
So you started introducing it to your practice, and what have you seen?
I've seen amazing results. I've seen all of that. Decreased inflammation, improved healing, faster healing.
So explain to me, what is your practice like?
So my practice is a foot and ankle practice that encompasses pretty much everything foot and ankle that you could think of. It's a high surgical practice. So I do a lot of trauma. I do a lot of sports medicine, and then I do a lot of elective surgery as well.
Now, tell me a great patient story. Do you have one?
A woman that had come to me who had had leg pain for years, neuropathic type pain. So this was more of a nerve type of an issue. She was complaining of numbness and tingling in her leg. I used the amniotic tissue, and this woman went on to have a remarkable recovery, something that she was dealing with for years.
I mean, have you seen cartilage grow back in areas?
So I've used this amniotic tissue to help regenerate bone, to help regenerate soft tissue.
But people who've been suffering with pain for a long time, have you seen it work for them too?
One of those patients that comes in that says, hey doc, I've had this chronic pain for years. I've tried everything. I've tried physical therapy, I've tried surgery, I've tried corticosteroid injections, I've tried you name it. This is an alternative that you can offer to those folks.
So I had been to several doctors who'd recommended complete knee replacements, and I said, no, I'm not going to do that. But I also reached the point where I couldn't go much further. And I heard about Dr. Howe and her treatment, and I had stem cell injections in both knees. It's a little over a year ago now. The left knee is 100% pain-free. It's just tremendous success.
Well, right now, I'd like to introduce you to a very special guest who's joining us from Denver, Colorado. Now, he works with professional athletes, some of who you know, but I'm not going to say. Please welcome Chris Nisler. How are you?
I'm doing great, thanks.
Tell me, what is it exactly that you do?
Well, I'm a performance-based rehabilitation coach. So I work with athletes, active individuals, but primarily my main focus is elite and professional athletes.
Have you been using stem cell therapy in your practice?
I have. I've been using it for the past 6 years.
Okay, so explain to me, how do you actually use it, and what have you seen?
And I mean, NFL, I mean, it's like going through a major car accident every week.
Right.
So by incorporating the amniotic tissue into our therapy, we're able to keep them feeling better and moving pain-free and preventing injury in order to get through that marathon NFL season.
So what part of the body do you find it works most effectively in?
Man, I really haven't had too many experiences where I haven't seen success with it.
Well, and I venture to say that you came all the way here to talk to us today because it's important. I think this is a medical breakthrough.
Yeah, I mean, I would definitely agree, and it's, you know, I've spent the past 6 years of my life kind of waving this banner and showing people what it does. I've seen such great results with it. It's something I'm very passionate about. I mean, the thing that gets me out of bed every morning is having my players call me, text me, and say, you wouldn't believe how good I feel. I mean, I'm out moving around, like I was able to throw today and didn't have any pain. I mean, that's the reason I got into this.
Chris, I want to thank you so very much for your time, for your passion. Right now we're joined by regenerative medicine researcher from the University of Florida. Please welcome Dr. Mark Moore, PhD. Now, what has the research told you about regenerating the joints in the knees, the hips, and the shoulders?
The studies have shown that they have the capability to regenerate tissue, reduce pain and inflammation within the joints of hips and of elbows, etc.
Is this FDA regulated?
Well, the FDA does manage the process, and there are a lot of guidelines that have to be enforced and adhered to.
So how much testing is done to make sure that it's safe?
They've had decades-old research to show that they're safe, effective for healing all sorts of tissues, and so now they've been used in ocular uses. They've been shown to stimulate nerve cell growth, so they have a lot more potential that hasn't been tapped yet.
Well, Mark, I want to thank you so much for sharing your time today. I'm sure that you're very busy at the University of Florida doing the research, but is there anything else before I let you go that you would like to share with us?
So I know the story of one truck driver who had osteomyelitis of his toe. Basically, his bone was, his joint was severely degraded, and he had an infection, and so it was about to lead to amputation of his toe. So he had an injection of a flowable amniotic membrane, which saved his toe.
Well, I did it. I listened to what everyone said and said, you know what, I have to jump in. I went to Jill's lecture. I heard all about stem cells. I did my own research, and I did it.